The topic I chose for my presentation is nutrition and cancer prevention and treatment. To start off, we are going to look in on what cancer is and the different types of cancer treatment, plus their side effects. So the first question that I'm going to answer is, what is cancer? So in simplest terms, cancer is the mutation of cells in the body, abnormal cells in the body that continue to mutate. I chose the picture on the screen because I thought it was a good visual representation so that you can see the difference between normal cells and cancerous cells. As you can see, the cancerous cells are different from the normal cells in shape, size, color, and they also have a different number of chromosomes that are not arranged in an organized pattern as you can see normal cells have. They also have no boundaries, so they cluster together. So the different cells grow and divide and cluster together and create a tumor. Now, it is important, obviously, for intervention of cancer treatments to come in pretty quickly, fairly quickly, once cancer is diagnosed in the body, because they tend to grow and divide quite quickly. And you want to shrink those clusters that are of cells, of abnormal cells, and try to remove them from the body. Cancer affects many people, especially considering it is the second leading cause of death among women and men in the United States, just behind heart disease. In fact, in 2015 alone, there were 17.5 million cancer cases worldwide. There are many physical effects from cancer itself, such as the symptoms that your cancer may present in your body, as well as the cancer treatments once cancer is diagnosed, which takes a toll on the body. It can also take an effect on one's mental status to be diagnosed with cancer, and then once treatment begins, to be fighting cancer. It might feel almost like a losing battle, especially if your body isn't making the progress that you thought it would make in the time it would make. And it can also take a toll on your family members and your caregivers because they're watching the people that they care about and love fight. And it can be devastating to watch, and they may feel really helpless, especially when cancer treatment begins and the patient starts to suffer from the side effects of cancer treatments. They may feel that they can't help in any way and that their hands are tied in a sense. So cancer affects everybody, essentially, and that is why it is such an important thing to discuss and talk about, in my opinion. So there are different kinds of cancer treatments, and one important thing to remember is that not one cancer is the same. For example, stomach cancer is not like bone cancer. The way it presents itself is different. The treatment recommendations may be different as well. For example, in leukemia, the typical recommendation is a bone marrow transplant to have new bone marrow come into the bloodstream and in order to stop cancer from developing. Now, this may be different, may not be the recommended course of treatment in a different cancer. Another thing to remember is that not all bodies are the same, in the sense that they may not react the same to these treatments and they might have completely different side effects. Now, there are different cancer treatment options, and to name some, it's hormone therapy, surgery, bone marrow transplant, chemotherapy, targeted therapy, radiation therapy, and immunotherapy. Obviously, cancer is one of those things where it's constantly developing. We are constantly looking for new treatment and new cures for cancer through experiments, studies, etc. One thing I want you guys to notice when you're looking at the image on the screen is nutrition is not a cancer treatment. Nutrition and cancer prevention and treatment is the topic of my presentation. Yes, but one of the things that we really need to focus on and I want to highlight is that cancer treatment is not nutrition. Nutrition is not a cancer treatment, it is an accessory to cancer treatment to help cancer treatment and to help cancer patients going through cancer treatments. But one of the controversies that we are going to touch on here and that I am explaining here is that it isn't not a treatment. So it is not something that is required. Not every oncologist is going to recommend for a cancer patient to have a nutritionist or a dietitian or to anything like that, or to use food as a means of helping their cancer treatment. A lot of the times that they do, but not always. Now, all these cancer treatments that you see on the screen have some pretty intense side effects, such as anemia, infection, compromised immune system, nausea, pain that comes with swelling and nerve problems. This is where nutrition comes in, and it's during these side effects to help reduce some of these side effects and help navigate them and how to make you feel better. And nutrition, what it really is meant to do during cancer treatment is help your quality of life and to make sure that your body is not falling into malnutrition. So now we're going to go into nutrition during cancer treatment. Again, during cancer treatment, because nutrition itself is not a cancer treatment. So cancer institutes such as Livestrong Cancer Institute in Texas has rethought their approach to cancer through the CALM model, which is Cancer Life Reimagined, to give patients interdisciplinary care for better outcomes. Now, this is something that's controversial in cancer care, is putting a team together of different doctors with different specialties. And on this team, it would include people such as therapists, nutritionists, and dietitians. Oftentimes, some cancer institutes do not include nutritionists, dietitians, and therapists in their team or in their plan because they do not feel that it is necessary or anything like that. It's also sometimes not the easiest to prove nutrition is helping cancer treatments. Even though there are studies and experiments done, it is still not the easiest to prove. And it's only recently, you can tell by the date on a lot of the research that I've done, 1997, 2019, 2018, 2015, that nutrition has come into cancer. So it's still very new, the idea of nutrition helping during cancer treatment, which is another reason that it is not often thought or talked about or assigned to cancer patients. But places like Livestrong Institute in Texas have integrated nutritionists and dietitians into their program. Now, diet is one thing that can help minimize the side effects as well as support the body during these intense treatments. Nutrition is important during this time because nausea, vomiting, and diarrhea can result in weight loss, which makes you lose muscle mass as well. Low muscle mass can cause poor outcomes due to low tolerance from the body. So in order to keep weight on, high-calorie diets can help. So some nutritionists, dietitians, they assign their cancer patients to have a target high-calorie diet, which means that they have to reach a certain amount of calories each day. And this way that they're ensuring their body's getting the vitamins, nutrients, and protein in their diet that it needs to function and sustain itself and to heal. So a lot of the times, to not overwhelm the patient, the nutritionist will split their calorie intake into 6 small meals instead of 3 big meals, especially due to the fact that nutrition, like eating, can be really difficult during this time, especially due to food aversions, because your taste buds can be damaged and foods you liked previously may not taste as good. It can also be difficult to swallow due to mouth sores and to eat due to the mouth sores. They may also not be able to keep anything down at all in their diets and in their food. So a lot of the times a liquid diet is recommended, or something such as a feeding tube may be recommended as well. Now, this is something that can be quite controversial is the idea of using a nutritionist rather to finding foods that your body can tolerate rather than going to a feeding tube because you risk your body already going into malnutrition. Um, and also meeting these targets of your calorie intake that or your plant-based food intake that your nutritionist assigns can be really difficult. In terms of when we talk about nutrition and cancer treatment, plant-based foods doesn't mean vegan or vegetarian. It mostly means those whole foods, grains, vegetables, fruits. You want those to be a main staple in your diet. But again, if somebody has a taste aversion to vegetables, the nutritionist isn't going to push you very hard, especially because you're going through cancer treatment. And if the only thing you're craving that day is pizza, then they're going to let you eat pizza because if you can tolerate it, if you can keep it down, at least it's some calories and some kind of food going into your body, which again is kind of people find it difficult to justify having a nutritionist when all they want to do is just eat whatever their body can tolerate instead of trying to experiment and trying to eat foods that your body doesn't, even though it's good for you, it doesn't necessarily want. And also sometimes supplements, it's hard to take other supplements because sometimes supplements can intervene with treatment and they're not necessarily recommended. So they just immediately go to a feeding tube and to get the proper supplements for the treatment that they're having at the time. So that's something where nutrition is controversial. However, in one cohort study, the regular consumption of green tea reduced mortality and recurrence of breast cancer because researchers and those who studied um, this experiment say it's because of the primary polyphenol in green tea, which is EGCG. Now, this discovery could not have been done without using nutrition during cancer treatment. So I think it definitely has its benefits. And there's other foods as well, such as vegetables and fruits and grains that have proven to help during cancer treatment, help during cancer prevention and reoccurrence. That proves at least that nutrition is helping during cancer treatment and should be something that should be included. This infographic, I feel like, does a good job of explaining this as well, because it answers the question, why is nutrition important for cancer patients? So 80 to 90% of people with cancer have signs and symptoms of malnutrition because of the side effects of their cancer itself and the cancer treatments they are receiving. So they are having a nutritionist help navigate this time with them and help keep track of their levels and advocate for them and stuff like that helps prevent malnutrition from happening. And then 20 to 40% of people with cancer may die from malnutrition or its associated complications. Put this into perspective, it's 3 in 5 people. I think this is something that needs to be talked about because complications include cardiac events or cardiac issues because your body doesn't have the proper nutrients and energy in order for your heart to work properly and pump blood across your body properly. Now, these effects of malnutrition can sometimes last even after a patient reaches remission, which is why it's something that needs to be looked over from a nutritionist point of view, I believe, before and after treatment. And proper nutrition can help patients speed up the healing process and navigate side effects of cancer treatment. Again, like we talked about before, cancer treatment and cancer itself has a really big mental and physical toll, not only the body, but mental health as well. So, having a nutritionist there to guide you and to give you those feel good foods and help your body meet the needs that it has to during this time can be really helpful and take less of a burden off the person, as well as help them in the long term when they do reach remission to make sure they're healthy and can hopefully have a lifestyle that they want and they had before they received their cancer diagnosis. So, what can you do to your diet for cancer prevention? Diet changes for cancer prevention has also been a bit controversial because it's hard to study a diet, for example. And one of the main things that people are going to tell you is first that you have to stop tobacco use if you use tobacco, or to not use tobacco at all to stop cancer from being prevalent in your body, as well as stopping alcohol consumption as much as possible or stopping it altogether. Another controversial area of nutrition and cancer prevention is that sometimes cancer is a genetic thing. For example, in breast cancer, there's something called a BRCA gene. BRCA gene is passed down and usually is can be tested for in your system now. And it's just a question of if the BRCA gene is activated or not to produce breast cancer. But if you're a carrier of the gene, there's only so much a diet can do in preventing the gene from being activated in your body. So this is where, again, it gets a bit controversial in the idea of nutrition stopping cancer from becoming prominent in one's body. But still, having a well-balanced diet is still something that is recommended for cancer prevention. And this is not only useful for cancer prevention, but other diseases as well. So it's definitely something to take under consideration and to duly know and integrate into your life. The recommendation usually from nutritionists is a primarily plant-based diet, trying not to eat processed foods, as well as limiting red meat. This is also can be known as a Mediterranean diet, and in certain studies and experiments, there have been evidence that being on a Mediterranean diet can reduce your chances of getting cancer and can help cancer recurrence from reducing. The reason these plant-based and whole foods are so important is because they contain something called phytochemicals, and phytochemicals help to boost your immune system, protect you against disease, help fight disease, and overall help to keep your body healthy and maintained. And so that's why doctors so recommend this primarily plant-based diet, is because of the phytochemicals, especially because phytochemicals are processed through the body quite quickly. So having them throughout every meal and them being the main focus of your meal and the meat being an accessory to this, to the whole foods, is more beneficial for you and reassures your body is getting the phytochemicals that it needs to fight off anything in the body. And of course, along with nutrition in your diet, they also recommend having proper exercising, not being under or overweight according to what your body measurement is, and that kind of stuff. But again, this, to reiterate, nutrition is not a cancer treatment. It doesn't stop cancer. It's not going to necessarily fight the cancer itself. It's there as a tool to help you and through the side effects of cancer treatments, and to help you sustain a better quality of life as well by finding foods that will make you feel better and will help heal you faster and help you, because during cancer treatments, again, like I mentioned before, your immune system is compromised. So having foods that can reintegrate vitamins and minerals into your body to help fight off infection can also help you during cancer treatments. When you are compromised, you are susceptible to more infections. Food can be your friend in this case, and nutrition can help you very much. It is not something that can necessarily altogether prevent cancer right now. Unfortunately, there's nothing that we can say wholeheartedly prevents cancer at the moment and is successful in preventing cancer 100%. But nutrition and having a well-balanced diet is beneficial for you in so many ways. So it's something that you can do and make that lifestyle change, because it's quite easy to do. And your body will feel better, and hopefully in turn you will not get sick because your body's feeling better. It's getting the vitamins, the minerals that it needs to function and sustain itself as a person. So it can, again, it has its benefits of integrating nutrition into cancer treatment and cancer prevention. but it can be controversial in a lot of doctors' minds of whether or not it is actually doing something. I think it's most beneficial in cancer prevention and those who are in remission after having either on a feeding tube or having taste aversions, learning how to eat again. A nutritionist and nutrition can be really helpful in guiding them through this process that can be really complicated to do on your own and to understand on your own. So, overall, I think nutrition and cancer prevention treatment mostly benefits the person. It's not a treatment, it's not a solid prevention, but it does help. And that is something that really should be taken into consideration. And I think that's why it should be recommended by doctors more often, as Livestrong Institutes has implemented it in its plan for its cancer patients. I think it should be implemented into plans across the nation to reduce the prevalence of cancer and hopefully help have a better outcome out of cancer treatments and cancer preventions. This is my reference list, and thank you so much.